Welcome everyone to today's webinar, Pivoting to Improve Medical Practice Operations and Safety in a Post-COVID World. I am Laura Dierda with Becker's ASC Review. Thank you for joining us virtually today, and we hope that everyone is staying healthy and safe. We will begin today's webinar with a presentation, and we will have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, I'd like to welcome our two fantastic presenters. Mike Peluso is a career-long revenue cycle professional with advanced skills and expertise in specification, development, and implementation of software technologies to accelerate the revenue cycle for health plans and healthcare providers ranging from small practices up to large regional enterprises. Prior to joining Rectangle Health in 2013, he held senior leadership roles with multiple revenue cycle technology companies. Michael's portfolio accomplishments include the establishment of the Rectangle Health Enterprise Solutions Division that serves health plans, hospitals, and large multi-site physician groups by providing unique and customized patient payment solutions. He also migrated the practice management bridge technology to a secure cloud-based platform that supports pre-authorized healthcare processes and latest chip technology, credit, and debit cards. Brian Stone is the co-founder and chief strategy officer for Clearwave. He brings a wealth of knowledge to Clearwave, including more than 35 years of executive experience in the healthcare industry. Prior to joining Clearwave, Brian served as CEO of MD Exchange, an enterprise and community-wide web-based patient record and communication system. As one of the original founders and investors in MD Exchange, Brian possesses a great deal of knowledge on the complexities of integrating with numerous healthcare stakeholders. His experience also includes the development and sale of two national outpatient imaging companies, Signal Medical and Link Scientific Imaging. Brian has served on the board of Javion, a predictive analytics company, since its inception in 2012. Now, it is my pleasure to turn the presentation over to Mike and Brian. Mike and Brian, if you are available, feel free to start the presentation.
Thanks, Laura. Good afternoon, everyone. We're going to go through some conversations today around how practices can adjust their existing operational models for the COVID-19 situation and really understand how they can make their practices more efficient. There's a lot of focus on reduction of unnecessary contact within medical offices. There's a lot of focus on meeting staff and patient expectations for safety and overall getting back to business. A lot of medical organizations have been out of business for the past 45 to 60 days and have had very limited contact. So now it's back to how do we recover that lost revenue? How do we get back to business? And again, I'm going to focus on a technology aspect of offering technology for flexible patient solutions, but also offering technology to allow better patient expectations and better patient experiences. Excuse me. As we all know, there are a lot of challenges out there today. I'm not going to go through any of these in extreme detail, other than the rates that insurance companies are offering to orthopedic groups, ASC centers, just about any provider out there, are starting to get compressed. There's a huge surge in procedures that need to be done. But the high deductible insurance and increasing medical debt requires us to have a better interaction with the patient and utilize technology in a better way to service patients. As with a lot of practices, and as with a lot of organizations today, that a lot of organizations are noticing, the ability to collect from patients, the ability is outdated. We're doing post-service collection still. There's still a lot of mailing paper statements. Even patient balances are getting written off when there's technology and there's options out there for us to better address. And these issues that I'm outlining right here, they existed before COVID, but they're being amplified due to the current COVID crisis. The last two, really, redundant data entry and long waiting times. We'll focus a lot today on what we call the clipboard. A lot of offices are still utilizing that clipboard to get patient information, and that clipboard requires redundant data entry. A patient fills it out with their pen or paper, then an office staff ends up keying it into a system. So there's redundant entry there. There's also the safety issue that we talked about. And then also those long waiting room times. No longer, or post-COVID, do we want patients sitting in a waiting room, congregating, being near each other. If there is a way to enable technology to remove a lot of that and make it so that the patient can essentially come in, go to the exam room, and then exit the office. And the technology that I'll go through today will highlight a lot of that. Just to highlight the workflow that I just talked about, it is a long workflow, and it is very, as we like to say, inefficient. The revenue cycle from the time a patient schedules an appointment to the time the patient gets a bill in the mail and they actually pay it, it'd be up to 90 days. And I've seen it higher to that in some practices, and there are definitely efficient practices out there where it's shorter, but think of 60 to 90 days, it's a very long process. And that time the patient spends in the office filling out forms, in the waiting room filling out forms, can be average about 16 minutes. So they're spending a lot of time, again, with that clipboard that we were talking about. Demand is also really building up. To be honest, 6.6 million orthopedic procedures were on tap for 2020. For the past, let's go 60 to 90 days, those procedures haven't been done. So there's a lot of built up demand, and there's catch up that's going to need to be done. On top of that built up demand, there's now a tremendous amount of people, as we all know, that are going on unemployment and possibly losing their employer-based insurance. So combining these two factors really creates a perfect storm for providers of how are we going to better address this scenario? How are we going to better ensure that we can see patients safely, but also how are we going to be able to ensure that we can get paid from those patients as well? So it's definitely a compounded problem. And I'd like to go through today with all of you some of the technology solutions that many of you know about. Pre-registration products aren't a secret. They've been out there for quite a while. Patient payment technology like card on file and recurring payments are also not a secret. They've been out there for a while. I think a lot of the providers that I'm speaking to today, I think a lot of you know about these solutions. What I'd like to do is re-highlight them, and I'd like to give everybody the option to look at it as more of an opportunity. Right now is the best time to put in some of those solutions, the best time to leverage some of those solutions for your offices. From a safety perspective, and I'm not going to tell anyone how to run safety, but from a less contact perspective, an eliminated waiting room perspective, and then also from a payment efficiency perspective. As I said, patients have some new expectations, and this is, I think these were in place before the current crisis, but now they've been amplified due to the current crisis. And those expectations are really personal safety. They want to feel comfortable going into a medical office. I think a lot of us have seen the stories of how people having a stroke or people having a potential heart attack have not gone into the hospital because of that safety concern. So we want to address that safety concern. We want to make the environment as contactless as possible. So the less touching that a patient has to do, the less standing around in a waiting room that a patient has to do. And then lastly, we want to enable more of a consumer experience. Again, I think everyone has heard how Amazon is thriving during the crisis. And that's really because Amazon has built this experience. I know the at-home delivery is a big piece, but they've built this experience that allows a consumer to go online, click on whatever they want, and it shows up at their house 2 days later. A lot of people don't even look at the price. A lot of people obviously don't even enter their card information. There's no card swiping. You could even do it relatively easily from your phone. So that consumer experience that Amazon's created has definitely allowed them to stay as prosperous as they have been through this process. And to highlight some of that consumerism effect, 95% of consumers say they would pay their provider online if there was an online option. 71% of consumers said they would leave their card on file with a provider and pay via a mobile device if the alert was available via the mobile device. The last bullet point in this slide is one that really has surged in the past 2 months, and this goes for the medical and retail type industries. Contactless payments have gone way up. All of a sudden, the Apple Pay feature in everyone's phones, or the Google Pay feature in everyone's phones, or even the NFC that is in a lot of people's credit cards, you know, that NFC chip that is in a lot of folks' credit cards, are now being more widely used just because it eliminates that touch factor. So again, that's that consumerism piece. The other thing that I think, you know, some of these companies have done, and I'll use the Netflix example first, is they've had this technology in place well before COVID. I've done this presentation a few times, and I actually normally ask this as a question. I say to a lot of providers, or I say to a lot of CFOs of hospitals, I say, what are your days in AR? And a lot of them would say, oh, you know, my days in AR from a patient are 60, 90, 120. I mean, some of them have said that with a lot of sort of self-confidence, like they're very proud of 60 days. And then I ask the opposite question, or another question of, well, what do you think Netflix's days in AR is? And a lot of them go, well, it must be high. They're a multi-billion-dollar company. Netflix's days in AR, just in case anyone's interested, is 0. They also don't send out any paper statements, also 0. It's all set up so that everything goes against the Netflix user's card on file. And people are very comfortable with this. Consumers are very comfortable with this. And COVID has actually created a scenario where consumers have become more comfortable with this. I use Uber as another example, and I think Uber is even more relevant now in healthcare, in that Uber set up a design where, you know, you go on your phone, you hit a button, a car comes and picks you up and takes you wherever you need to go. And at the end of that experience, a lot of people just get out of the car. There's no friction around the payment. There's no having to pay the driver. There's no needing cash. Well, Uber has enabled that because they've captured the patient's card on file well ahead of time, or they've captured the consumer's card on file well ahead of time. And it allows that experience to be very frictionless. And believe it or not, most people who are asked about their Uber ride don't know what the price is. They just know that they got to where they were going and they were able to get out of the car. What a lot of the technology that we're going to talk about today allows a medical practice or a medical office to do is enable that Uber-like experience for the medical practice. A link could be sent ahead of time. Patient registers their card on file, provides some of their pre-registration information, maybe a picture of their insurance card, which we'll go through. And then when they go to the office, there's no waiting room. They go immediately back to the exam room. They have their exam. And then when they exit the office, there's limited friction around paying. That office already has their card on file. So essentially the patient, other than things outside of their copay, can essentially leave that office. So to reiterate, how do we position for recovery? We ensure patient safety with new arrival procedures. We increase pre-care collections. We employ efficient payment methods. We implement some new processes, and we streamline receivables and collections. And we utilize this current crisis as an opportunity to do that. And it took me a while to be comfortable saying that, but it is really, it's an opportunity to leverage these types of features, not just because they make your office more efficient and they make your office a better practice, but because they make your office or your medical institution, they drive what the patient is currently looking for. The patient really is looking for these types of solutions in a post-COVID environment. So what would that new workflow look like? That new workflow could go from 90 days down to possibly 1 day, possibly 10 days, possibly 30 days. And that average time spent on forms is no longer in the office. It's digitally on a patient's device. And they can do it at home before they get to the office. They could do it in their car, possibly when they're at the office. But there's definitely a lot more efficiency and a lot more control from the patient, and a lot more safety involved in doing it via those types of devices. So again, I'm the technology guy. Without getting too nerdy and talking about how to write code and things like that, I like to highlight to everybody the technologies that exist out there today that allows a lot of these things to happen. And as I said, we're going to focus on the patient arrival first, and then we'll talk a little bit about payment processing and recurring payments and a little bit of post-insurance payment processing. But we're really going to focus on the patient arrival because this has the most COVID-like impact. You want to eliminate as much of that as patient touch points as possible, where we can have a patient fill out their pre-registration information, fill out that clipboard that we don't like to hear about anymore, fill that out ahead of time, and we can notify the patient when they can enter the office, and we can bring the patient directly to the exam room, and we can do that in a very effective and efficient way. Over the years, I've worked with a lot of technology vendors, and I've really found a great partner in an organization called Clearwave that Brian Stone founded. And I like to say they were working on patient intake and patient registration well before it was the cool thing to do. So they've been doing it before COVID, before a lot of the vendors that are out there today. Clearwave really specialized in how to get a patient in the door as efficiently as possible. And now with the COVID effect, I believe that they've done it in a manner where it's very safe and it's very sort of patient friendly. I'm going to go ahead and go to the next one and let Brian Stone talk for a few minutes.
Thanks, Mike. It's interesting when we started the company and looking at the clipboard, as Mike said, one of our primary goals was really to reduce the data entry, the redundant data entry that occurred. That the problem that we initially looked to solve was the amount of time it took patients at the point of service to complete the paperwork to ultimately get back to the clinical area. Patients do not come to a orthopedic practice to see the front desk. They're there to see the doctor. So that bottleneck, with the clipboard created a bottleneck, and it actually was that all that paper drove a lot of a lot of time for your registration staff, delayed patients, delayed the schedule and the doctors from seeing the patients because they get caught up on that front end. So our focus was really to automate that and streamline that process and get the patient from the front door to the clinical area as quickly as possible. That has been our premise since 2004. What's interesting now with COVID-19, if you think about the clipboard and you think about the exposure to germs, it's probably one of the most germ-infested devices or things that you have in your office. Handing that clipboard, handing the pen, the paper. So now there's a secondary motive to essentially get rid of the clipboard, and that is patients are now concerned about handling what other people are handling. Looking at the manual process, a check-in process today with a clipboard, there's at least 6+ touch points related to taking the clipboard, the pen, paper, handing it back, and you're handing it to a person back. So again, from a COVID-19 perspective, patients are very, very leery of that technology. When you look at what digital registration, what the form factor, kiosk or a tablet, in an in-office touch point, kiosk, the patient's using one finger. So from a touch point perspective, they're using one finger and typically have a Perol bottle next to it. We also, over the last 60 days, we've seen, to Mike's point, we've seen more and more patients really doing the pre-check process. It's been out in the market for years, but now patients are looking for that, looking for ways that they can complete information prior to coming in. We've seen practices and been able to completely change workflows within our client base to allow patients to essentially complete everything at home and actually be able to sit in their car and, as Mike said, be notified with a text message, it's time to come in. So essentially our offices have created, their parking lot has become their waiting area. And I think that, one overall point to make here is, one thing we've learned is that, you have to give patients a choice. I think transitioning to a digital registration process is key. And to Mike's point, 100% of the patients will not use PreCheck, 100% of patients will not use their phone. You have to be able to have a platform that supports multiple form factors, because some patients are more concerned about the COVID-19 crisis. I can share with you, walking through a grocery store, I walk in with a mask on, and there's probably 40% of the people in the store that are walking around and don't have no fear of anything going on. So again, implementing a digital registration process that provides different form factors, I think will be critical as we emerge out of this post-COVID-19 era. Mike, I'll pass back to you.
Thanks, Brian. To kind of reiterate what Brian said, that digital patient engagement is critical, and as he said, to be able to engage the patient via different mediums is important, whether it be even with a one-touch kiosk in the office, or it be the ability to text the patient an invite or email the patient an invite. It really is, how can we engage that patient digitally, and how can we get them as comfortable as possible with their future medical visit or with their impending medical visit. And this works across a lot of different scenarios. We've seen it in dental, we've seen it in medical, we've seen it in orthopedic, we've seen it in surgery centers. We've even started to see it a lot in hospitals as well, where they just want to give the patient that digital presence, give the patient the ability to provide that information up front. As Brian also talked about a little bit, anything that can be done contactless is safer. So there are scenarios where that contactless is really going to work, and the contactless has to be simple for the patient. We don't want the patient to have to download an app. It should work via the patient's browser on their phone, and you'll see on this slide it's an iPhone. It should work via the patient's browser on an Android phone if they use an Android phone, and it's always on. So from the time the appointment is made to the time, and again, like Brian said, to that patient is sitting in their car, they could be working on this type of registration, and it is contactless. Even in a waiting room scenario, and I know I was painting the perfect picture of no waiting rooms before, but even if you had the patient in the waiting room, if they can use their own device to do the registration, that helps as well. Anything we can do to eliminate that clipboard, eliminate that paper redundancy is really beneficial to the patient and to the practice. Some of the things that make it beneficial to the practice, but simpler for the patient, are things like being able to take a picture of the patient's insurance card. So the days of the patient handing the insurance card over to the front desk person so the front desk person can make a copy of it, those days are kind of gone. We can eliminate that contact. The other nice part about taking a picture of the insurance card and doing benefits and eligibility verification can be that a lot of patients, and we know unemployment is very big, a lot of patients may be losing their benefits. So to be able to verify that and be able to understand that prior to the visit is very important and can be very beneficial to any office, any surgery center. So that be able to have that picture and be able to check that eligibility and insurance. Obviously, in the COVID world, and I think going forward for years to come, every patient questionnaire will have some COVID-related questions on it. So as we're engaging, as you're looking at solutions to check patients in digitally, you want to make sure that you have the ability to ask some of these questions, because if you could send this over to a patient before they come in, and they answer any of these questions that may qualify them as a COVID patient, you may want to handle them differently. So you want to be able to allow that, and you want to be able to have those questions ahead of time. as I talk, and I have a lot of experience in the payments space, I think the most important thing, the thing that not only secures payment for the practices, not only makes the patient experience more efficient, not only gives an office that consumer-like experience of an Amazon or of a Netflix or of an Uber is after that patient gives all their demographic information and some of their clinical information, the ability to get that card on file. I think that's super important in that now they don't have to give it when they come to the office, so it eliminates that contact. But again, it also, as I was saying, it also gives that office that consumer effect to it. So think about it, the patient's leaving their card on file well ahead of time, and they could be leaving it for every visit to that office, just like you leave your card on file with Amazon for every time you purchase something from Amazon, just like you leave your card on file with Uber for every time you take an Uber ride. So getting that card on file up front gives you that consumer-like feeling. It also makes your office a lot more efficient. You may not have to send out as many bills. You have cards on file now. You don't have to have the patient stop and pay their copay as they're exiting the office. You now have their card on file, so you can do their copay that way. And as you utilize the card on file, the technology that you're utilizing should have the ability to communicate to the patient via text or via an email saying, we're about to run a payment against your card on file. Do you want to approve? Or we did run a payment against your card on file. Here's a notification or here's a copy of that receipt. But that card on file feature is becoming very important. And I wish everyone did it. During COVID, I order a lot of takeout, and I wish I could call the restaurant, order whatever I want, and go and pick it up, and they had my card on file. I still have to call the restaurant, order something, and give them my card number over the phone, or if they don't take my card number over the phone, when I get to the restaurant to pick up the food, I still have to hand my card over. I mean, and not that I don't feel it's safe, it's just if the restaurant could eliminate that and get card on file ahead of time, then I just need to, pull up to the restaurant, open the trunk of my car, someone could run out, put the food in, and then I can leave. So I think that's a really good experience that medical offices and providers and healthcare institutions can do. And Brian's going to actually go through an example of one of his customers that actually have been utilizing card on file for quite some time. And this again is that pre-COVID example that we're trying to highlight that has become a lot more relevant during COVID.
Yes. So this is thanks, Mike. This is actually a client that had started down the path of doing card on file, and I think an important point to make when you're looking at implementing digital registration, any type of digital registration, self-service process, be it pre-visit or be it during the point of service with a tablet or kiosk, is that whatever you program that software to do, with 100% surety that software is going to do what you ask it to do every single time. And I think that the challenge historically has been, as we come into practices and we start talking about practices about collecting copays and outstanding balances and cards on file, if it has a human involved in it, number one, you have really no way of tracking if that person did in fact ask for a copay or did in fact ask for a card on file. With a digital registration process, you do. And what we found in this client was pre-Clearwave, they had somewhere in the neighborhood of 30 to 35% of the patients would put their card on file when asked. Again, we don't know what percentage of patients were asked and what percentage of patients weren't asked. But they also had, from time to time, a kind of a difficult conversation. Patients would begin to ask the staff, "Why am I doing this? Why do I have to do this? It used to not be this way. What are you doing?" And what happened was after they deployed, the Clearwave digital registration process, all of that went away. It just became a known requirement. The technology, the digital registration kiosks and tablets asked for the process, automated the process, got the authorization, got the signature, got the card, passed it off to Rectangle Health, and they saw over 90% adoption without any complaints at all. So on the digital registration side, it can help drive the adoption of card on file because it's automated and you're taking the human interaction out of it, which actually increases the overall probability of getting the card on file. I'll turn it back to you, Mike.
Thanks, Brian. So again, to what Brian said, and to really sort of put a cap on the card on file, is that this type of practice that Brian was talking about, Sierra Pacific Orthopedics, they were utilizing this functionality well before COVID. But as we sort of look at the COVID crisis and we look at coming out of the COVID crisis, that card on file functionality just solves so many problems and creates such a better patient experience that we really believe it is the way to go. Now, there's always going to be the patient that isn't leaving their card on file, or the patient that forgot to do their pre-registration, and how do we address them when they do arrive at the office. And I just wanted to talk really quick about some of the point of care tools that can eliminate a little bit of that contactless. As I said before, there's Apple Pay and there's Google Pay, and there's cards now with NFC. All of a sudden, these have surged in usage. So you can have these types of tools within your practice as well at the point of care. Additionally, at the point of care, or within the office as a back office functionality, you can have the ability to offer recurring payments. Most technologies today have recurring payments. Recurring payments, if we were to think of Netflix, have been around for quite a while. They're really designed in healthcare for a financial hardship against a large balance. If you have a patient with a $1,000 balance or a $2,000 balance or a $5,000 deductible, and they owe that money to the office, you want to be able to give them that ability to split it up over time. And it's a non-recourse. They're not taking out a loan. It's basically just a way to take the payment from their credit card or even their checking account in smaller increments. And really during the COVID crisis, we understand that a lot of people are furloughed. Maybe a lot of folks are laid off, but you want to continue to deliver medical care. And you want to do that, as much as possible, as we talked about earlier with the surge. So if you can offer patient payment plans, non-recourse patient payment plans, non-loan patient payment plans, the technology is out there to do that. And again, it gives you that patient-friendly experience. It also gives you that consumer experience of our office has the newest type of functionality to address these types of concerns for patients. We also talk a little bit about technology in the post-care world. I know Brian and a lot of the presentation focused on engaging that patient pre-care, but there may be a scenario where the patient does still get a bill. And when they do get that bill, we want to make it as consumer-friendly as we can and as technologically enabled as we can. So can we deliver it via the mobile phone? Can we deliver it via an e-statement rather than a paper statement? And e-statements and mobile phone, they're delivered immediately. So there's no waiting for mail. There's no waiting for someone to get the mail. It's on their phone. You're going to know when they get that statement. So there's also sort of a timing factor of, the bill, like a lot of the medical bills at my own house, it's not going to sit on the counter for 2-3 weeks unpaid. It's on my phone. I'm going to open it up on my phone and I'm going to pay it almost as quickly as I possibly can. It gives your office that always on feel to it. And again, these are all with our Rectangle Health logo on it. These would all be with the office logo on it. So it's really a digital presence for your medical office, for your organization. And that's really just a highlight of online patient payments. Again, it's payments on your website. So even if you don't digitally deliver a statement or you don't deliver outstanding balances via text message, patient could still get a paper statement. Well, if they want to pay that paper statement, they don't want to write their credit card, they don't want to write a check, have a link on your website where a patient can make a payment. And that can add a lot of that consumer-friendly functionality to your office. I went through a lot of technology today as a recap, and I think a lot of folks listening to this have heard of a lot of these solutions before. These aren't solutions that are all of a sudden coming out because of the current crisis. There are solutions that have been out for quite a while, and the current crisis has heightened the need for these types of solutions. It's also giving us the chance to implement these types of solutions. So they're definitely out there. Text-to-pay capabilities, contactless registration, Apple Pay, Google Pay. A lot of this functionality is out there, and now is the time for the medical practices to utilize them. Real quick, before I jump into the questions and answers, we worked with an organization over the past 2 or 3 years to implement a lot of these solutions. And it was an orthopedic group, and that orthopedic group wanted to accommodate flexible payment options. They wanted to offer a lot of the things that we just talked about to you around getting the card on file up front, around taking the patient payment at the point of care, around being able to integrate all of that information back to their PM system. So we were able to do a lot of that with an orthopedic group, similar to a lot of folks on the call. And that orthopedic group was able to consolidate locations, so they actually could move their practice into a more efficient environment. Their patient satisfaction went up quite a bit. Efficiency with all the posting, all the digital factors, and then obviously the ultimate goal, they were able to lower their accounts receivables because of it. I wanted to thank everyone for their time, and then open it up for some questions and answers.
Thank you, Mike and Brian, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on your dashboard. We will try to get through as many questions as we have time for. And we already have several questions coming in, so this should be a great discussion. Mike, the first question I have here is, so you are asking the patient to download apps on their mobile devices. If so, what is the average number of patients who have the capacity to download the apps and in fact electronically engage with those medical apps? So what percentage, I guess, of the patients are able to do that?
Sure. Well, let me just clarify that a little bit. We're not asking the patients to download anything. All of this functionality should work through the browser they already have on their phone, or the browser they already have on their device, or through text messaging capability they already have on their device. So there's no need to go to the App Store or to go to the Android store and download anything. All of this functionality should work through the existing browser on their device. So I don't really have a percentage for you. I have that they don't need to download anything.
Thank you for clarifying that. That's very helpful. The next question we have here is, what percentage of patients utilize a self-service in a practice?
Thanks. I'm gonna turn that one over to Brian. He's our self-service patient check-in guru.
Thanks, Mike. So we see well-run practices. Patients will use self-service, and those practices that implement it as a kind of permanent change and as a kind of a must-have, we see 80 to 90% self-service utilization. So when you hit those types of targets, what you'll find is that you free up your registration staff to truly begin to focus on the patient and focus on the patients that need their help. But we see, I think, across all of our clients, it's about an average of 82%. We have some clients that have 99%, checking in using self-service, but on average, it's over 80% across our client base.
That's great to hear. Thank you for outlining that for us. The next question we have here is, how long does it normally take to implement a pre-registration process?
I think I'm going to actually give that one over to Brian as well. He's again the pre-registration guru on things, so he has a lot more statistics on that.
Yeah, thanks, Mike. It's real interesting. Pre-COVID-19, our process would include a bi-directional interface to the practice management system that an orthopedic group would work with, or an ASC. So we would see somewhere between 60 to 90 days from an implementation perspective. Now, as part of COVID-19, we're now spinning up some clients in a kind of a quasi-integrated mode in 7 days. So we have a process to be able to extract, files and appointment information by dropping a file, and we can get that done in 7 days. So in the normal world, it's somewhere between 60 to 90 days. But with COVID-19, we've been able to spin up a kind of quasi-integration in 7 days.
Got it. That's good to know. The next question I have here, Mike, is what is the cost to implement the type of solutions that you're discussing?
Mm-hmm. So a lot of the payment technology that I've outlined and a lot of the registration technology that I've outlined can be incorporated into costs a lot of practices currently have. Practices are currently paying for traditional payment processing, traditional, taking a payment at the point of care. So a lot of that type of functionality practices are already paying for. So there's no additional cost. It's just a matter of switching to a newer technology provider. As far as the advanced patient registration and items like that, there can be costs around, think of a SaaS fee or a monthly fee to have that software. So it can be a hybrid. In some instances, it can all be in the payment processing costs. In other instances, depending on the size of the practice and the level of customization they need, there may be an additional incremental SaaS fee on top of the payment processing fees.
That makes sense. Thanks for outlining that. The next question we have here is what practice management platforms does this model integrate with?
There isn't a limitation on the practice management platform. It's going to integrate with most, if not all. To outline specific ones that it may not integrate to, would take us all day on this call. So it's designed to integrate with most, if not all. As Brian said, some of the integrations can be very in-depth in terms of exchanging appointment information, in terms of exchanging payment information, balance due information. So some of them can be very in-depth. Others can be more of that, as Brian used the term, quasi-integration, where you can utilize a lot of this functionality and the integration is limited or not as in-depth. So there really isn't a system limitation. There may be a level of integration limitation, but we would have to know specifically which systems we wanted to talk about.
Perfect. Thank you so much. And then another question we have here comes from an attendee saying, we have issues with payment plans when we run them monthly. They claim fraudulent charges even though I have them sign an agreement and I have to spend time trying to prove the charges are legitimate. Do you have any suggestions?
Sure. So we can, again, get the digital signature now, so we can have that on file, and I know the person already asked that. In addition to that, some vendors will guarantee that type of information or guarantee that type of charge, meaning if you go through the steps of getting the authorization signed, you go through the steps of having the patient agree to the payment plan, and then the payment plan goes into effect, and there's a chargeback against one of those, your vendor should be able to guarantee that information and guarantee that chargeback. And that's something that certain vendors can help you out with.
Perfect. Well, let's see here. That is all the time we have for today. I want to thank Mike and Brian for their excellent presentation and Rectangle Health for sponsoring today's webinar. Enjoy the rest of your day, and we will look forward to having you join us for future webinars.